pleased to say that the Health Secretary, Sajid Javid, is with us again this morning. It's lovely to see you again. My goodness, a busy man you are.
Thanks for having me.
£6 billion. Is it really enough to bring down the waiting list?
It's a huge amount of money. Look, I'm full of praise for everyone that works in the NHS. I want to see what we can do to support them in bringing down those waiting lists and getting more patients seen more quickly. And this £6 billion that we'll be committing to in Wednesday's budget, it's huge. It's going to be more buildings, more equipment, more investment in IT. This is going to mean things like at least 100 more community diagnostic centres. That means millions of more scans and tests and checkups. It's going to be investment in beds and buildings and equipment and surgical hubs, and investment in IT, freeing up the time of our dedicated NHS staff so they can see more patients.
Is it going to be enough?
It's based on what we obviously work very closely with the NHS. It's what they've asked for. It's what we're putting forward. Of course, that we all understand why we've got a much bigger waiting list than we've ever seen before in this country because of this terrible pandemic. And we want to make sure that as many of those people can get seen as quickly as possible. And that requires not just investment in the sort of, what we call the day-to-day costs of running the NHS, the staff, the treatments and all of that, but also investment in capital equipment, things that you can see like buildings and IT investment. And that's what this £6 billion is about.
The Cabinet Office said repairing waiting times would cost between £2 and £10 billion a year for the next 4 years. So that's £40 billion. So £6 billion per year, is it, and then a bit more? No,
this is so. If I may, so you might recall actually a few weeks ago you had me on your programme and I set out the investment in what we call the sort of the day-to-day costs over the next 3 years, and that's basically what's coming from this NHS and care levy, which is the £12 billion a year for NHS and care, and so that will cover those day-to-day costs. What today's announcement is about is the capital equipment or the capital investment. So the things the NHS has to buy that are used again and again, things like beds or the buildings for the new surgical hubs or the equipment, there's the CT scanners, this kinds of big pieces of equipment. So we also needed, alongside investment in people, investment in this kind of equipment and buildings and beds. And that's what this £6 billion is about.
OK, and is it all new money?
It's all new money.
OK. Talk to me, if you would, about the lack of staffing. 100,000 vacancies in the National Health Service, I believe, this morning, amongst them 40,000 nurses. It's not just about a physical lack of beds and equipment, is it?
It's not. Look, we've had a long-running staffing challenge in the NHS in the last year. The numbers are going in the right direction. I think we've added over 3,000 doctors, some 9,000 nurses. You may know that we've got a commitment to have 50,000 more nurses by 2024, and that's all going well. But we are looking and trying to recruit all the time, and some of that can be done quite quickly if you can get people in that already obviously have the qualifications. But some of it obviously requires investment. That's why I was pleased this year, this summer, when we had the usual entrance into medical schools. I removed the cap, so we had the highest number of people going into medical school that we've ever seen. OK. 106,000 NHS staff are not vaccinated. We've seen what's happened in in social care, I should say. Are you considering going the same route with them? We are considering it, and we've been very open about it. And I think this is what you're referring to. I think there's the requirement in the care system at the moment that you are. That's right, that you are vaccinated, and the vast majority of people I speak to in the care sector, that's exactly what they want, because they know it's not just good for them, but most importantly, it's important for the people that they're looking after, so well. In the NHS, we are thinking of doing the same thing. We've been very clear about this. There was a consultation on this. It's just closed, the public consultation. We've yet to make a final decision. But look,
are you leaning towards?
Yeah, I'm leaning towards doing it. I've been quite open about that. I've been clear about that in Parliament. Well, I can't set that out yet because the consultation has just closed. And if we do this, we want to do it properly. We want to work with our friends in the NHS and get this right. But it's worth just stepping back a bit and thinking, why is this important? It's because the people, first of all, those fantastic people working in the NHS, they are naturally more vulnerable to being exposed to diseases and viruses, and of course that includes COVID, but also the people that they're looking after so well are naturally vulnerable. That's why they're in hospital, and it's about giving them the protection they deserve to.
But can you afford to do it, given that there is 100,000 vacancies already and we're talking about 106,000 more?
I think that if you keep in mind the more than 1 million people that work in the NHS, I think the NHS, so far, it's over, I think 94, 93% thereabouts that are vaccinated, people that work in the NHS. And so there is around 100,000 that are not at this point. But what we saw with the care sector is that when we announced the policy and then we set it in law, November the 11th is the sort of cut-off date, then we saw many more people come forward and do the right thing and get vaccinated. And that's what I hope, that if we do the same thing with the NHS, we will see.
But given how stretched the National Health Service is at the moment, I mean, you have got a lot of equipment, you do have spare beds, but you don't have spare capacity when it comes to staff. If you can't afford to lose one member of staff, let alone 100,000 or 10,000.
It's about doing the right thing. I think that if we didn't do this, just think about that for a second. You would basically have people that are working in the NHS that haven't got vaccinated when they could have. Remember, people in the NHS and care were rightly offered vaccines right at the start when we first had vaccines. So if they haven't got vaccinated by now, then there is an issue there about patient safety. And that is something, of course, the government would take very seriously. That's why you'll find, actually, I think most countries in Europe have already done this.
OK. So you say you can't tell me at this stage when you might put that into place, but I'm guessing it's going to be this year.
Well, it will take some time to get it through Parliament, and then we also then want to give time to those people who haven't yet had vaccinated to actually go and still have some time to go and do that, to get double vaccinated.
Away, yeah.
No, I wouldn't say that at all. Look, I don't want to put a time frame on it, but it wouldn't be months and months if we decided to go ahead.
Can you reassure expectant mums that the NHS can provide them with adequate care? I'm referring, of course, as you know, to an article that's in The Guardian today saying the NHS could soon be unable to deliver the care it needs for women about to give birth. That is terrifying.
Of course I can reassure them. I mean, no expectant mum should have that kind of concern. Look, I'm not going to say for a second the NHS isn't under huge pressure. Everyone can see what's happening. It's been throughout the pandemic. We've seen the NHS rise to a huge challenge, and that challenge continues. Yes, of course, we're in a much better place today because of the vaccinations, but there is still a challenge ahead, not least because of those waiting lists. But when it comes to the priorities and making sure people have the health care they need, of course, maternity care and care for expectant mums is always going to be there.
Up there at the top of the list, I would have hoped.
Of course.
Boosters, where are we with boosters?
It's picked up substantially in the last few days. Why is it picking up? Because I think a couple of things are happening. Is that, first of all, more and more people are getting eligible. And so as each day goes by, there's more and more people that can then come forward and get their boost. But also, I think more and more people are becoming aware of this. It's quite a new programme. It's been going 4 weeks. We've delivered over 5 million boosts in England. And in the last 72 hours, I think some 800,000, more than 800,000 boosts. So it's going along, and picking up nicely. But that said, I still want everyone that's eligible, please come forward, because again, if we look at where we are today as a country with this pandemic, we're in a much better place, primarily because of the vaccines. And if we want to keep it that way, and I think we all do, the best way to do that is to come forward and get your boost as soon as you become eligible. And you can do that by booking it online or by calling 119.
OK. Are you looking at shortening it from 6 months to 5 months, as one of your previous colleagues, Jeremy Hunt, had suggested? I know you're going to say JCVI will have to look at that for you, but what do you think? Well,
I'm going to say JCVI because they are the experts, and I think people would want us to listen to the clinical experts on something as important as this. They've been clear so far, and they've said that you should be getting your boost at the 6-month point. But it won't surprise anyone to know that they will, as they've said at the start, they will keep that under review. And if it makes sense to shorten that, then they will give us that kind of advice. And then as ministers, we would look at it.
And what about the walk-in centres? Why can't people just, given that it's just so important for the safety and security of the NHS not being overwhelmed this winter, why can't people just walk into a walk-in centre and get one?
They could, as long as they're eligible. They've got to be eligible.
OK, I thought you still had to register online.
You have to. So what's happened? The vast majority of people are booking it. So they
But what if you don't want to? But what if you're just walking past a walk-in centre?
So most of the walking centres, if you are eligible, if that means you're over 50, phone, then you'll know. You're over 50, and it's been at least 6 months since your second jab, then you're eligible. It's highly recommended you book it first. I think it just makes it easier for those vaccination centres to manage the numbers. But some of them are allowing people to walk in and do that.
Yeah, but
as long
only
as they are
some, as you
eligible.
say. You clarified it there, Health Secretary. Only
Yeah.
some. So people who are being turned away, it's even though they're eligible, that's not right. They should be able to have their jab if they.
Well, what we've got the biggest offer in terms of vaccination this country's ever seen with boosters. So, for instance, we've got some 500 more vaccination centres offering boosters than we had with the original vaccination programme back in April. And so we're making it and we'll continue to see what we can do to make it as easy as possible. And it's working because more and more people are coming forward. On Saturday, I think we had over 325,000 in England.
Which is fantastic.
And I want to see more.
But I'm just clarifying with you whether people can actually, if they are qualified, if they can qualify, they can actually go to a walk-in centre.
If it's a walk-in centre, they can go. If it's a walk-in centre.
OK, talk to me about anti-vaxxers. Outside schools, 3 kids were injured because these anti-vaxxers are protesting outside schools. How are we going to protect children?
These people are doing so much damage. First of all, as you say, here you have 3 children that are injured. They're actually physically injured, and that's heartbreaking to see that children that are going about what they should be doing, going to school every day, and you've got these idiots outside their school just spreading vicious lies. And it is a problem, and I've got to say it's become a growing problem as time has gone by.
How are you going to fix it?
Labour
is suggesting an exclusion zone.
There are options, and in terms of whether it's an exclusion zone or other potential action, I think it's got to be done at a local level with local police. I think it's what makes sense for that school and that local area. And as you would expect, local police have been, throughout the country, have been fantastic in working with the schools. The Home Office has taken this rightly very seriously as well, and they've been helping with advice to schools as well. We have a unit in the Home Office that will give advice directly to head teachers about what they can do. And I think, though, there's only so much that can be done at the end of the day. You will still have people, for example, that are sending completely fake letters to parents. They will be posting letters through parents' doors, completely fake, with really advice that is just based on lies. And they've got to understand that if they don't want the vaccine themselves, at the end of the day, that's their choice. No one's going to force them. I think it's a bad decision to make, but that's their choice. But they shouldn't really be passing on this kind of false, vicious lies to ordinary people, especially parents that are trying to do their very best to look after their children.
And your message to those anti-vaxxers that injure children?
Well, if you've injured children, that is a criminal act, and I hope that in that case the police are able to track those people down. But my message to anti-vaxxers, if it's not for you, then fine, just stay at home, but leave others alone.
It's always great to see you, Health Secretary.
Thank you very much
for joining us. Thank you.
Thank you.